your child is still growing, so is their scoliosis, because scoliosis progresses rapidly during periods of rapid growth. And knowing where your child is along their growth spurts is critical to getting the right treatment. And if you don't understand where your child is along the growth spurts and how much growth they have remaining, it's really difficult or impossible to select the best and most appropriate treatment. Hi, I'm Dr. Chris Gubbels, leading authority in the non-surgical treatment of scoliosis and the head scoliosis clinician at Scolicare Denver. Failing to treat scoliosis during the early stages of growth is like showing up to the airport and the plane is already left. You've literally missed your window of opportunity to get the most effective treatments and the best possible outcome. And although we can still treat curves when they're larger and later on during the growth stages, we can get the most effective and typically the least aggressive treatments when we catch those at the beginning of growth spurts. Now, when we catch the treatments early on, sometimes we only have to do scoliosis specific rehab or exercise. Sometimes we may just be observing them if the curves are really tiny, or if we're doing bracing, we may only have to do bracing part-time or just during the evenings or do a nighttime only brace. But as the curves get more severe and as they progress, so do the treatments. So when we get larger curves, generally we're doing more intensive or more aggressive scoliosis-specific rehab, and that's typically when we are doing full-time bracing. So the earlier we treat it, generally the less we have to treat it as well. And the bigger the curves get, and if we catch them later on, then the curves get more aggressive. Additionally, the goals of treatments change as the size of the curve changes. When we catch curves when they're small early on, we are really working to reduce the size of the curve as much as possible. And although we still work to reduce the size of the curve when curves get larger, how much we can reduce that can change. Because as curves get larger, they get more spinal deformity and they get more difficult to reduce the size of those. So when people present to our office and they already have very large curves, the goal is more to stop it where it is and prevent it from progressing to surgery, because those curves can be more challenging to reduce the size of the curve. So it's critical that you're going to providers that understand where your child is along their growth spurts so they can recommend the most effective treatments. Now, let's take a look at how the rate of growth changes over time, because it's not consistent throughout entire growth spurts. Now, during childhood, between the ages of basically 3 and 10, your growth is pretty steady. And we look at this dashed line on the graph represents the rate of growth. The red line represents scoliosis progression. Now, the majority of scoliosis actually starts here with the onset of puberty. And with the onset of puberty, you go through an initial phase of rapid growth. Puberty typically lasts about 4 to 5 years, typically 4 years in girls, 5 years in boys. But when someone hits puberty, those first 2 years, you grow at an extremely fast rate. That's where you see this dashed line right here. This is called your peak height velocity, because that's when you grow in height at a very rapid rate. Now, after about the first 2 years, the rate of growth slows down. Although you're still growing, during the second half of puberty, the rate of that growth slows down over time. What's also interesting is before puberty, during childhood, the majority of your growth actually comes from your limbs. But with the onset of puberty and growth spurts, there's a shift in where the growth in your body comes from. And with the onset of puberty and growth spurts, the majority of the growth actually comes from the spine. So we get this perfect storm where we have the spine growing very rapidly or the body growing very rapidly during the first 2 years of growth spurts, but also the majority of the growth is actually coming from the spine, or a higher percent of that growth. And this is why curves can progress very rapidly over the earlier phases of growth spurts. Now, let's take a look at an example where a patient went to provider and they didn't understand where they were with the growth. This was a 13-year-old girl, so it was an adolescent idiopathic scoliosis, and she had presented to her physical therapist. And the physical therapist told her that this curve was not a concern, she's done growing, come back in a year, it's not really something to worry about. So that's what the parents did. But when they came back a year later, it had progressed to 43 degrees. And at this point, she was recommended for surgery, and this patient actually ended up getting surgery. So what did the provider miss? Well, the provider thought the patient was done growing, looking at the pelvis of something we call Risser 5, and I'll explain that in a minute, where in actuality, she was just beginning her growth spurts. The provider thought she was up in here and done growing, and she was actually over here. She was just taking off. And like I said, this person actually ended up getting surgery because they did not get the right treatment, because the provider didn't understand how much growth they had remaining. So let's take a look at how we actually assess the remaining growth, because it's not just about age, it's about bone maturity and bone age and how much bony growth is left in the body. There's a couple of ways we can assess bone age. and skeletal maturity. One of the most popular ones, is known as Risser sign. And the Risser sign is how we evaluate the growth plates in the pelvis. So right here, we're looking at the pelvis. You have the spine, you have 2 femur heads, and this is the pelvis. Over here on this, you can see there's a growth plate right here. And Risser sign is labeled anywhere from 0 to 5. 0 negative when someone hasn't hit their growth spurts yet, and it's 5 when their growth plates are completely sealed. So in this example right here, this person would be Risser 2, starting Risser 3. You can see this growth plate coming around. This growth plate will calcify all the way around, and then it will eventually fill in, so there's no dark line, it's completely solid. And when you're done growing, it looks like this. Now what's challenging is Risser 5 can look similar to Risser 0, so there's some other things we can look for in the spine. Now Risser sign is a nice easy one because a lot of times you already have the pelvis on your x-rays, but it's not the most accurate, and knowing where you are as far as the peak growth height or the rate of growth is challenging to judge by the Risser sign because that can vary a bit. A more accurate way is to use what's known as the Sanders sign. Now, the Sanders score, we actually look at the growth plates in the hand because we have growth plates in all of these digits. You can see them here at the distal, the middle, and right here, the caudal phalanges, and then also right here, and then even in the wrist bones. And these all close at different time frames. But we can use this to know when someone's completely done. Once this last one, the radius in your hand is completely sealed off, we know someone is done growing. But we can also look at all of these to determine where they are alongst their growth spurts and where they are with the rate of growth. And that's a good predictor of determining the risk of progression of curves. Now, if you're watching this and your child has scoliosis and you're wondering how much growth they have left and what the risk of their curve progressing is and what the best treatments are, you can click on the link below and request a free discovery call. And that gives us the chance to get in the phone and we can discuss your individual case, the risk of the curve progressing and what treatments that you may be a candidate for. Now, both the size of the curve and the amount of remaining growth are the 2 biggest things that we have to combine when we're looking at and predicting the potential for the curve to progress or get worse. And what I mean by this is smaller curves, if there's still a lot of growth remaining, can still have a really high risk of progressing. But if you have a smaller curve and you're almost done growing or you're an adult, that may be a curve that we're not that concerned about. Large curves, if we catch a large curve and there is a lot of growth remaining, a lot of times orthopedic doctors just assume they're going to get surgery and don't do any conservative treatment. But those we have to address the most aggressive. But even larger curves when someone is done growing can still continue to progress. For example, a curve over 30 degrees has an increased likelihood of continuing to progress even when someone is done growing. If a curve is over 50 degrees, they will 100% continue to progress. So we have to look at both the size of the curve and the amount of growth remaining to have the best predictor of the likelihood of the curve progressing and selecting the best and most appropriate treatments. Because when it comes to treating scoliosis, timing is everything. And our mission at Scolicare is to make sure our patients get the right treatment at the right time so they can get the best possible outcome. So if you're watching this and you have scoliosis, your child has scoliosis, be sure to request a discovery call so we can review your individual case and let you know what your best treatment options are. And now that you understand how growth in your spine impacts selecting the best treatments for scoliosis, another thing we have to consider is the location of the curve. Because curves at different spots or locations in your spine tend to progress differently at different stages of bony growth or skeletal maturity. So to learn more about how location of the scoliosis impacts decision making when selecting the best scoliosis treatments, click on the next video and we'll see you there.